Hi, my name is Catherina. I am a nurse educator in CVSKL.
Hi, I'm Chai. I'm the ICU Nurse Manager in CVSKL. So we're here basically to answer some frequently asked questions. Hopefully it's helpful for you. Why don't we start with our first question? Okay, so usually people will ask, how do I care about my puncture site when I'm discharged home?
Okay, so basically the puncture site can be either at your wrist or at femoral, which is at your groin. If it is a femoral approach, which is at your groin, then you shouldn't do any heavy lifting or squatting exercise at least for 1 week until you see your doctor for your next appointment. And secondly, you shouldn't drive for 1 week. And if let's say there is a bleeding you found at your puncture site, what you need to do immediately, basically you have to lie down and press at the puncture site. So if the bleeding is persists after 5 minutes, then you have to seek treatment immediately in the nearest hospital. Sometimes you will find some kind of infection or signs of infection at your puncture site, such as swelling, redness or an abnormal discharge. So what you need to do basically is you have to go and see your doctor immediately, because this could be an infection sign. Okay? And lastly, you will see some kind of bruises or hematoma near to the puncture site or at the puncture site. Basically, this will subside within a week, but if it is not subside within a week, then you should seek treatment in the hospital.
Well, very comprehensive explanations. Thank you, Catherina. Now, how about the second question? Usually people will ask, when can I start traveling?
Okay, traveling is basically depending on your advice from your doctor. So if you have a routine angiogram or angioplasty, what will be the advice from doctor is basically you can fly within 2 to 3 days after post-procedure. But if you have an heart attack and you have done the angioplasty or angiogram, then it depends from the doctor. But from my experience, doctor will try to ask you to delay the flying at least for 4 to 6 weeks. Okay, Miss Chai, I have very interesting questions for you. Okay, how long after angioplasty I can engage in sexual activity?
Oh, well, usually the first week after your angioplasty, you're not advisable to actually engage in any sexual activities. But of course, you can always re-clarify with doctors upon your follow-up sessions.
Okay, another question for you is, after how long I can go back to work following angioplasty?
Well, it depends on what occupations that you're in. Usually for normal angiogram, 3 days will be sufficient. But for angioplasty, it's advisable up to 1 week. But if you have had a heart attack, then you might require a longer rest of 4 to 6 weeks. Yep.
Okay, so that is from us basically. So we hope our answers able to help some of the frequently asked questions from our patients.
Well, stay heart healthy and stay safe.
Thank you.